So we're at the L video now. And for L, I decided to make a video about lower back pain. A short video about lower back pain. And what can I do in a short video about lower back pain? Because there are entire encyclopedias and conferences and books written about lower back pain alone. So what can I do with a short video on this subject? Well, I can briefly do a few things. I can tell you a bit about why it's so common. I can tell you some of the most common reasons then. And I can tell you a little bit about how to try to decrease the risks of getting lower back pain and lower back problems. And if you have it, I can tell you a little bit about how to try to manage it. Again, this is from a trainer's perspective. Please, in no way take this as medical advice, because it is not. Now, if you try anything or what I'm suggesting, please understand that this is at your own risk. Right. So with that out of the way, let's get started. So why is lower back pain so common? Well, there are different theories around this, of course, and I think different people will have different opinions on this subject. But I subscribe to the theory that we are basically not designed to be standing upright. It's not so long ago as we were crawling around on all fours with our spine or our back parallel to the ground. And in a quite short time span, we started walking upright. And that put entirely different loads on our back and on our spine. Standing upright means much higher loads on vertebra and discs between the vertebra than when walking on all fours. So walking upright and the high loads on the columna, on the back, on the spine, puts entirely different stress on the vertebra and discs then, again. This means that the risk of some kind of a problem with the vertebra, or more specifically the discs between the vertebra, increases a lot. And this problem can be a slipped disc, as it's called, when one of the discs between the vertebra slips out a little bit in some direction. It also increases the risk for a disc actually breaking a little bit and having the contents spill out a little bit. And that can cause pressure on nerves and nerve endings, which are lying very close to the back. The pain can also be muscular. It is not uncommon that when you have some disc problem or back problems, that the muscles around the spine tenses up, getting really stiff and hard to protect that area. And the source of the pain can be that muscle or these muscles. In addition, you can have back pain and back problems from pure arthritis. So what can we do to decrease the risk of ever getting back problems or lower back problems? Well, from my perspective as a trainer, the solution is probably quite obvious. It's about moving and training your back in all the different planes, in all the different directions. It's about strength training, it's about mobility. And there are a lot of muscles in your back and surrounding the spine. There are several layers, I think 3 layers of muscle, some would say 4 layers. You have the long erector spinae muscle close to the spine all the way, and you have also a lot of small muscles between all the vertebrae, and all this I think should be trained and moved as much as possible in all the different planes. In addition to this, you also have the fascia, of course, which covers all of the body, and that includes the back. And if this dries up, it can be brittle, tense, and it can also be a source of problems. So you need to make sure to take care about your fascia as well. That's how you can try to decrease the risk of lower back pain or any back pain. But what if you already have it? What if we have some serious problems with our lower back and the pain is severe? What can we do about it? Well, it depends again, and I think there are many different opinions on this, but I'd say the process goes something like this. In the initial phases, consult with a physician or physiotherapist. Try to understand in detail what the problem is. You're probably going to need some rest at the beginning. It's going to be so painful that you cannot really move around a lot, especially if you're talking about a slipped or broken disc. So some rest, and you should probably take painkillers. And that you do, well, to manage at all, but also so that you can move at least a little bit, because movement is generally good if it doesn't make the pain a lot worse. So painkillers can help there. Move gradually more as the pain hopefully starts to go away. Now understand that this takes some time. It takes weeks or months probably, so try to be patient even though it's hard. Eventually the problem will become manageable, most likely in most cases. It will become manageable without surgery. Surgery is really a last resort, and it's not often you have to go that way. Now, once it's becoming better, increase movement, move around more, and engage a trainer, or preferably a medical trainer, who can help you with the right kind of exercises to strengthen your back and decrease the risk of this pain reoccurring. You may also have an uncomfortable feeling in your back for a long time. Me personally, I had a back problem, lower back problem, which started probably around 12 years ago. I was diagnosed with a slip disc 3 years ago when it became really, really bad. Actually, it was a broken disc in my case. It took a couple of weeks, but I followed this process. It got gradually better. I can still feel it, but with the right kind of movement, with the right kind of training and exercises, it is manageable. And that's the way it's going to be for most of us. But if you stop taking care of your back, if you stop moving around, the problem will probably get worse again. So adding to this, I would say in the initial phases of the acute pain, to try to decrease the pain, you should probably try to position yourself in a non-load bearing position for the back. So a position I've found is really helpful is to lie in your back, flat in your back, with the calves up on a chair. So you have 90 degrees angle in your knee joints and 90 degrees angle in your hip joints. This is a non-load bearing position for the back, and it decreases the pain just by being in this position. And combine that with painkillers, it will short term make the pain more manageable. One comment about this. Now if your back pain is caused by arthritis, the process is a bit different. You cannot train away arthritis like in the example I just gave you. Initially, arthritis is usually treated with NSAIDs, which stands for, and I have to read this, NSAID stands for non-steroidal anti-inflammatory drugs, so anti-inflammatory drugs. So this was a very short look at lower back pain and lower back pain from my own personal perspective. I described the process which I find helpful when managing my own and others' back problems and recommending the course of action. There's a lot more to be said about this, but I hope this was somewhat useful short introduction to lower back pain and its management. See you soon again.